Good morning and welcome to WPKN 89.5 FM in Bridgeport, Connecticut. My name is Dr. Jennifer Pierre and I am the host of Seeking Wellness, Our Bodies Explain, where we discuss different health topics that are concerning to you and we shed some light on some interesting things about it and also from a naturopathic perspective. And you can also listen to past archives at wpkn.org, listen to recent podcasts. All of our information is online. Now today, we'll be discussing cold and flu season. Obviously, this is a topic that everyone is talking about, and either you've already had a cold or flu, or you know someone who's struggling with a cold or flu. We're going to be discussing the differences between the cold and flu, what the flu is, the CDC recommendations, and the flu vaccine. And lastly, I'll be wrapping up with some naturopathic recommendations on how you can stay healthy during this cold and flu season. To begin, what exactly is the cold? Well, a cold is a viral illness caused by what's known as the adenovirus or the rhinovirus. These are the two strains that are mostly responsible for the cold. And some of those symptoms include runny nose, stuffy nose. Sometimes people mention having a head cold and just feeling really, really congested. In contrast, the flu is also similarly caused by a virus, but is generally caused by influenza A. And its peak replication is just a few days. For most people, by day 5 or 6, there's no more replication happening. By that time, the flu's moved on to someone else. And the interesting thing about the flu is it comes on very, very quickly. That's a contrast to the cold, where it seems to take a little bit more time when you start feeling it. Flu activity peaks between December and February, and sometimes it can even last all the way through May. Some of the accompanying symptoms that you may notice will include muscle pain, malaise, weakness, fatigue, headache, watery eyes, sore throat, or cough. Keep in mind that there are other viruses circulating around this peak flu period that can actually be confused with the flu, but have similar symptoms. And some of these viruses, of course, are the common cold and another virus known as RSV, but that mostly affects children. The main difference I think that we need to keep in mind is that the flu generally comes with a fever, and unfortunately it has much more severe complications. And some of these things can include bronchitis, pneumonia, myocarditis, which is an inflammation of the heart muscle, and also encephalitis, which is an inflammation of the brain. So now we can see why the flu can be so concerning. For most people, the flu will start out as a head cold, having a runny nose, feeling very, very fatigued. Sometimes you'll even notice changes in sleep, having a severe headache, feeling dizzy, fever, as I mentioned earlier, and having those body aches. The body aches are definitely very significant in the flu, whereas most people, if you're having a cold, that doesn't seem to be one of the symptoms. A cough can come along with it, or sore throat, sometimes even losing your voice, laryngitis, and then the loss of appetite. Some people have symptoms such as nausea, vomiting, even diarrhea, breathing difficulty, or chest pains. And I think this is very important to note. If you start to notice chest pains, that can be the onset of pneumonia, which is really, really important to keep in mind. And also it's more of an emergent condition. And many people, once they get to that state, one of the hallmarks of that is spitting up yellow mucus. So if that happens, you're dealing with some sort of bacterial infection. Many times that also can look like bronchitis. I know myself personally, many years ago, I had a really bad flu. And along with that flu, how I knew something really strange was going on is I had bronchitis with that flu, 103 fever, laryngitis, and severe body aches. During that time, I was in college and I was pretty much out of commission for almost 2 weeks. And this was during my first semester as an undergrad. And that brings me to a point of what's really important about this whole flu cold season is that if your body is already at a decreased immunity, meaning you haven't been taking care of yourself, you're not sleeping, you're basically just going through the day-to-day hustle of life and not doing the things you need to do, that's when you're most susceptible to the flu. Let's talk some more about what the flu actually is. I mentioned before that it's usually caused by influenza A viruses, but some flus can be caused by influenza B. But these viruses are divided into subtypes. And these subtypes are based on the two proteins that are actually on the surface of the flu virus. And these are called hemagglutinin and neuraminidase. There are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes. If you've heard of the naming of many flus, the H1, that name that they've given things, so there's H1 to H18 and N1 to N11. And these, of course, are named after the proteins that I just mentioned. And then you can break down the influenza viruses some more into different strains. So in the current subtypes that are pretty popular that we tend to talk about are influenza A, the H1N1, and influenza A H3N2 viruses. This is why influenza A, H1N1, and H3N2 and one or two of the influenza B viruses are included in each year's influenza vaccine because these are the most popular, and that's why they're included into the vaccine every year. And also each year those strains need to be reassessed depending on what is noticed from the previous year. How does the flu survive? We discussed before about viruses and how prevalent they are. But there's a few things we need to know about a virus. So one important thing about a virus is it needs to be able to replicate. If it doesn't replicate, it won't be transmissible. So that is the first thing that needs to happen. Many people will actually pass on the flu before they even know they have symptoms. And it's easily spread. Say someone's having a conversation, those droplets that are produced either through coughing, sneezing, talking, can be transmitted to someone else. The droplets can land on their mouth, it can be inhaled into their nose, or even get inhaled into their lungs. If you remember many years ago when so many people were talking about the avian and swine flu and how dangerous they were and how much fear had spread even internationally, it was because these certain flus were adapted to certain species. So for instance, they're avian and swine flu because those are flus that are in the bird and the pig population. When they find themselves in something human, it actually switches into something that the human body is not used to. And when that happens, all sorts of terrible things happen. And that's why there was so much hysteria when that happened, because that was not what we were used to. That was not what the CDC was prepared for as far as what their recommendations were for the recommendations of that particular year. Continuing on, there are 4 types of influenza viruses. We're talking about 2 of them, A and B. And we're focused on A and B because A and B are responsible for the seasonal concerns that we experience every year in the United States. I mentioned before the hysteria with some of the other strains. If you remember in 2009, H1N1 was more of a new strain. It was a different strain and something that we weren't used to. There's generally influenza A strains, but not that particular one. And this was considered the first pandemic in over 40 years. What's interesting is that now this particular strain is what we commonly know in our seasonal flu, and it continues to circulate. And again, if we talk about replication, that is what the flu is supposed to do. And over time, it has evolved to what is just considered normal for us, whereas at that time, that was a very scary thought. There are certain changes that can occur in influenza. And 2 of those major changes are what's known as antigenic drift and antigenic shift. Antigenic drift is small changes in the flu gene that happen over time during viral replication. Most of the time, the immune system can recognize similar viruses and responds. Think of these flu strains as cousins. So for instance, if there's one particular strain and just over time it just makes little changes here and there, it's not much different than the way it originally started. So your immune system knows and recognizes this as something it's seen before, and then it can protect itself. This is known as cross protection. This is why it's important that the flu vaccine composition is renewed and reviewed, because they watch these different changes and decide to make changes to the actual vaccine based on what's happened in previous years and previous seasons. Then there is antigenic shift. This is a more abrupt major change in the influenza A viruses, and this results in new hematogluten and the new neuraminidase proteins in influenza viruses that infect humans. So this shift results in a new influenza A subtype or virus with the hemagglutinin or the neuraminidase combination with it. And that emerges into a brand new subtype that people don't have immunity to. So in contrast to the antigenic drift, this is something totally new that the body cannot recognize. And again, this is what happened in 2009. Unfortunately, there are certain years where the flu vaccine is not well matched to the circulating influenza viruses. And unfortunately, according to the CDC, it is possible that there may be little to no benefit from the flu vaccination if you have received it that year. So they try their best, but unfortunately, that's where some of the limitations lie. Even in years where the flu vaccine match is good, the benefits vary. This varies depending on various factors, including the characteristics of the person being vaccinated, what viruses are circulating that season, and even potentially which type of flu vaccine that's used. We've been talking about the flu, some of the characteristics, how the flu spreads, and how it survives. I just finished talking about some of the changes that happen with the flu. And that highlights why it's important to look at the vaccine every year and figure out how to make change. In 1918, there was a very particular flu that was an extreme pandemic, and many people died. Ever since then, there's been a lot of research trying to figure out what was so different about that flu that year that caused so many deaths. And that research continues. And a part of that virus that was prevalent then, of course, has been changing over time. And that's some of the things that scientists and researchers look at when they consider the flu vaccine. Who are most at risk? People who are at most risk for influenza infection tend to be the elderly, immunocompromised individuals, people with chronic illnesses, respiratory infections, people with cardiac illnesses, diabetes, and pregnant women. If you've gone to your doctor this year, most likely you've heard the recommendation that you should get the flu vaccine. And what I find is in my practice, because I'm a naturopathic doctor, many patients ask me, should they get the flu vaccine or not? This is always a very difficult question for me because I think it's an individualized question. There's a lot of different factors that need to be considered. One, what is your health risk currently? What are health risks that you've incurred in the past? What has been your reaction to the flu vaccine in the past? Do you consider yourself immunocompromised? Do you have an autoimmune disease? All these things should be taken into account. Most conventional physicians, they'll make this recommendation to most of their patients. And I like to look at it in a more individualized perspective. So sometimes that's what makes it harder for me to answer that question. And what I like to do and what I'm doing with this show today is pretty much giving you all the information so you can decide for yourself. And that's pretty much what individualized healthcare is. You have to look at that particular person and see where they're at and see what their body can handle or cannot handle and whether it would be appropriate for them. Of course, the flu vaccine can be very important and helpful for some people who are susceptible because the flu can be deadly, and it can be the type of thing where after it evolves, someone can get pneumonia, and pneumonia they can pass. But that's not the case for everyone, which is why we're talking about this today. As I mentioned, the flu vaccine can change every year, and that is one of the criticisms that comes up. And the CDC itself points out that it gets better with trying to predict what those strains are, but it's not a perfect science. It's something that's constantly worked at, and they're trying to get the match better, but certain years are better than others. So one of the criticisms is, why should I get this vaccine? And it's not even going to be really good this year, or it might not match up too well. And because of that, many people are on the fence about the vaccine. When the CDC looks at the vaccine for that particular year, they try to predict how dangerous it may be. So behind some of that fear is that, and this is a quote directly from the CDC, a great measure of the virulence of an influenza virus and probably other respiratory viruses is the ability to change the respiratory epithelium. So it is set up for a secondary bacterial pneumonia, which then kills you. And that particular statement reflects the fear around wanting to get the vaccine and who is more susceptible to getting the vaccine. Now, what can you do if either the vaccine is not appropriate for you because of maybe your immune system is even too compromised to accept the vaccine, or if you have an allergy to the vaccine? I have a patient in particular who has an allergy to eggs. And more commonly here in Connecticut, there is actually the flu block vaccine that's offered that doesn't contain eggs. All these things need to be considered because many people have a bad reaction to the flu vaccine. And I think that's very important because you can't just blindly state that everyone needs to have a vaccine without considering what are the ramifications for certain people, especially if there's illness or they've had a bad reaction to the vaccine in the past. So those are some of the things that we need to consider and decide when you're saying, should I get this vaccine? Many of my patients don't have the option if they're in the military or they're teachers. They can't really make that decision. But I will say there's definitely a level of discomfort for many people. And I think what's challenging for me is that, firstly, I'm a public health professional. So I've been trained in public health, and my first priority is to look at the health of the public. But also, along with that, I also have to think about whether something's appropriate for someone, and I can't blindly just paint a picture that one thing is good for everyone. And that's where naturopathic medicine comes in. So what can we do if we want to make our bodies stronger? And that works for everyone, regardless of whether you're going to get the flu vaccine or not. You want your body to be in a healthier state anyway. So what are some of the things that we can do? So as far as prevention, there are certain things that you can incorporate and take to make your body stronger. And in the naturopathic world, we call these immunomodulating herbs, or herbs that will actually strengthen your immune system. So that's one route that you can approach. But what do you do if you actually do get the flu? And let's say you haven't gotten the flu shot, or you're one of those people who got the flu shot and you got a flu anyway. So one of the things that you can do is, this is kind of an old adage, but starve a flu. And this is where we're going to talk about diet and some of those things. With the onset of symptoms, first thing that you can do is restrict your dietary choices. Since your body is really trying to fight off this flu, you don't want to eat lots of food, because now you're diverting the body's resources to digestion when it should be working on actually fighting the flu. One of the things that's recommended is to avoid meat of all types, even organic. The body uses up a lot of resources to break down meat. And if you're already fighting a flu, that may not be the best decision. Along with that, avoiding eggs, milk, ice cream, and cheese. Cheese and dairy, all these things for many people can increase the amount of congestion that they have and phlegm. So adding those things in while you're already dealing with a suppressed immune system may not be the most beneficial. Along with that, avoiding sugar. What's interesting about avoiding sugar is this is also one of the CDC's recommendations. So this may be old school things that are passed down, but actually they've been seen to be very helpful. Avoiding sugar allows your body to be able to fight off these pathogens a little better. Along with that, avoiding alcohol, wine, recreational drugs, all these things can be helpful. Avoiding pizza, and then also getting plenty of rest. If you're having very stressful situations, that's going to be hard for your body to be able to fight off what it needs to fight off. So avoid stressful situations at all costs. Now, this may not be the case. This may not be easily done with many people. But if you can, this is going to help your healing a little bit more. Avoid getting chilly outside. If you're inside your home, turn up the thermostat just so that your body can be a little bit warmer. And also adding in some vitamin C to your supplement list can be helpful. Vitamin C is something that's been talked about for many, many years. That's another thing that's passed along. It's when, your grandmother growing up told you to eat more oranges or drink orange juice. Mainly that recommendation is made because of the vitamin C. And vitamin C has been seen to be very, very powerful in so many different things. Vitamin C has been used in cancer treatment. Vitamin C has been used just to promote a healthier immune system overall. So let's talk a little bit about some herbs that you can take that can be helpful in fighting off the flu. And I would like to start with one of my favorites, echinacea. This is probably one of the more popular herbs that many people are familiar with. And it's popular because you can get it on the shelves. It's not that hard to get, and people see a lot of improvement. What most people don't realize is echinacea is more helpful to you if you take it before you actually get sick. By the time you already are sick, you don't notice the advantages as much. So take echinacea either before the flu season, or hopefully you can take it at the onset of an immune challenge that you're having. Echinacea has antimicrobial effects, antiviral effects, and anti-parasitic effects. It's traditionally been used for colds, flus, and other infections, and this is based on the idea that it may stimulate the immune system to effectively fight infection. Echinacea has also been used in skin issues such as acne, boils, and different parts of the plant are used. As I mentioned before, it has antimicrobial properties, and it stimulates non-specific immunity. It supports the secretory immune function, and this includes your mucous membranes, skin, and also, as I mentioned before, very helpful for colds and flus. Your respiratory function is also strengthened with echinacea, so that is something that can be seen when you're using it. Let's talk about some of the research around echinacea. One of the criticisms around herbs and natural supplements is that there isn't much research. But there is a lot more research being done because I think especially as these herbs are getting more popular, it's a little bit easier to do more research and to see how these herbs are effective in the laboratory and how they apply to human beings. Supplementation with standard echinacea tablets, if taken before and during travel, may have preventative effects. And this was a study done by the Evidence-Based Complementary and Alternative Medicine in 2012. And this was shown that in a long travel, including long-haul flights, that it had preventative effects against people having respiratory symptoms. So that's pretty important. That's helpful to know. Another study looked at the prophylactic intake of echinacea over a 4-month period with people who had recurrent respiratory infections and saw that it prevented further episodes of the infections. One great combination that's seen to be helpful, and this was in a double-blind placebo-controlled study, and it evaluated the effectiveness and safety of a preparation of echinacea, propolis, and vitamin C in prevention of respiratory tract infections in children during a 12-week winter period. Propolis, if you're not familiar, it's also one of the products of bees, and it can be very helpful in strengthening the immune system, but also it has antiviral and antibacterial properties. So they created this preparation of echinacea, the propolis, and vitamin C, and they had children ages 1 to 5 taking this 2 times a day, and they did this study with 430 children. And what they found that this combination had a preventative effect on respiratory tract infections. So why is it that echinacea has this ability to help in these studies? Well, what they found is that echinacea actually induced lower levels of IL-6, and that is immunosuppressive cytokine, and it lowered levels more so than other cytokines measured. So that's pretty important. This is actually looking at your immune system and seeing how your immune system is reacting once you are taking an herb. And this is one of the critiques, is that can herbs really be this powerful to lower some of the inflammatory markers of our immune system? They actually can. These results demonstrated the immune stimulatory ability of the echinacea, and that's pretty important. Another study looked at fasting blood samples before people had a cold and after they had a cold. And it showed that echinacea was able to decrease the effects of a cold over time. So these results are pretty important. So let's talk about another herb. The next thing we'll talk about is elderberry. And I will say that I actually take elderberry every day. I find that whenever it's cold and flu season, this is just one of the most powerful herbs that you can take. When I mentioned earlier, the long time ago when I had that really bad case of the flu, for years after that, I used to get sinusitis or bronchitis. And I will definitely say my immune system was not the strongest it could have been. So one day I learned about black elderberry and started taking that, and it was very helpful as the years went by with helping with some of those cold and flu symptoms, and I still use it to this day. The flowers of black elderberry have so many different powerful antiviral, anti-inflammatory, antioxidant properties, and it's actually considered a superfood. Most people, if you go to, now it's a lot easier to find supplements with black elderberry in it. So if you go to your local Whole Foods, you'll find things. But it's actually a superfood. You can eat it. It's not just like a vitamin or a mineral. You can actively eat this. And taking the syrup every day in cold and flu season can be very helpful in strengthening your immune system. The berries are filled with wonderful antioxidants that are helping to have that power. And one of the things that you may or may not have heard about elderberry is it has quercetin in it. Quercetin is also an antioxidant that decreases inflammation. That's very, very helpful. A lot of times if you look at vitamin C protocols, like if they're using a particular type of vitamin C in a product for allergies, they'll have quercetin in it. And quercetin is really helpful at decreasing those inflammatory effects that you have that come along with a cold or flu. So now some studies about elderberry. Elderberry has been used, as I mentioned, with cold and flu. And there is one study that shows, and this was in vitro, that there was an inhibition of influenza types A and B. It's very helpful to see that elderberry has that particular power. And It's one of those things that's so easy, and it's not much difficulty in taking it, because when it tastes good, it tends to have a sweet taste, and there's less likelihood of taking too much and there being a problem because it is a food. It's a fruit. So that's why I like elderberry as well. It's a lot easier for people to take that, and the patient compliance is pretty good. Another study showed that elderberry patients recovered 3 times faster from the flu when they took 1 capsule of elderberry extract 4 times a day. And this was in comparison with patients taking a placebo. Sounds pretty good. The next thing we'll talk about is garlic. Garlic is, of course, something we cook with all the time. It has antiviral properties, and it's pretty powerful. Sometimes when we think about garlic, we're reminded of, those old shows with the vampires, and how garlic was able to, you're able to ward off the negative powers of this particular vampire. And garlic kind of works that same way in our bodies as well. 1 clove of garlic sliced and eaten 3 times a day can be helpful for subsiding some of the feelings of a cough and some flu-like symptoms. And it's pretty easy to do again. You can just eat the clove. You can boil the clove of garlic. You can blend it. I've done that before. I've blended the garlic with some citrus fruits and some honey and taken that as a syrup. That's a really easy recipe that you can use during cold and flu season. Some other nutrients I'd like to mention are zinc and vitamin C. Zinc is a mineral, and zinc is also used in a lot of over-the-counter combination formulas. And it's seen that zinc can also lessen the time of a cold. This is an important mineral just to have in your house, whether you take it in a vitamin or just keep it around. Zinc is also very helpful for acne, so this can be useful. And colloidal silver is also something else that's useful. So colloidal silver is not as well known, but you can take it as in a spray. It's it's a clear color. It doesn't have any taste, but it has some antiviral and antibacterial properties as well. And you can spray this into your throat. You can inhale this once every hour. I've actually used this with many of my strep patients, and it's been really helpful to get them through. Whether they've taken antibiotics with it or not, it can be very soothing. And again, it has those antibacterial and antiviral properties. Vitamin C, we've talked about this a little bit already before. Vitamin C can be taken in a higher dose when you're suffering with cold and flu-like symptoms. Most of the time you can just grab this over the counter as well. But when you have a cold or flu, when you actively have it, you can take it in higher doses again, as long as you're monitored by your physician. Because the only side effect that I have to mention with vitamin C is that if you take too much, it can loosen your stools. And that's pretty much how you know that you've reached your limit with vitamin C. There's also some research that has shown that vitamin C in very high doses has been very effective for pneumonia. And of course, that particular study was monitored very closely by a naturopathic physician. So it's not one of those things you want to try at home to go too high with your dosing. And lastly, I wanted to talk about oregano oil. Oregano oil also has antiviral and antibacterial properties. And there was a study that showed that 2 capsules taken every 4 hours was seen to lessen the cold and flu-like symptoms in a study. So we've talked about a few of those supplements that may be helpful. And as I mentioned before, the easiest thing to do is just to have a naturopathic doctor give you the dosing on that. I don't want to get too much into that, because if I don't know that someone's being supervised, they can just grab up all these supplements, and it might not be the safest thing to do on your own. So moving forward with some of the CDC recommendations. Because we know how influenza is spread, there's simple things that we can do. And I would actually say that a lot of these recommendations by the CDC also are naturopathic. They're pretty basic. They're things that we already know, but they are things that sometimes we forget. And in our day-to-day lives, we're moving so quickly that we may not do these things, and we just forget how to take care of ourselves just in the hustle and bustle. One easy thing that you can do is just washing your hands. If we look back in years past in the early 1900s and we talk about some of the public health hygiene issues that were happening in the country, most of them could be prevented if people just had better hygiene, including washing their hands. And it may sound annoying to hear this over and over again, but it's extremely important. We're touching doors all day long. We're shaking hands. We're going to the bathroom. We're doing so many different things. And sometimes not spending enough time washing your hands, you can have these viruses on your hands from something that you've touched. And if you just wash your hands, you can remove these things pretty quickly. If soap and water aren't available, you can use an alcohol-based hand rub. Anything that you can do to decrease that viral load that's on your hands or bacteria, which can sometimes be even worse, especially if you're ingesting these things or touching your face. The next thing you can do is covering your nose and mouth with a tissue when you cough or sneeze. I know a lot of teachers, even if you think about growing up, when the teacher would say to you, cover your mouth if you sneeze, or just sneezing into your elbow or coughing into your elbow. Imagine if you're talking to someone and they cough or sneeze in your face. That's almost like, it's very traumatic, because you can't even imagine how many things you're possibly ingesting in that time period. And that's exactly how the flu is spread. Those droplets that are given off when someone coughs or sneezes can be inhaled, and before you know it, you're done. Avoid touching your eyes, your nose, and your mouth. These are the orifices where things can enter into our bodies, and this is how germs spread. Stay home if you're sick. This is something that many people have difficulty with because they're so afraid to lose that time from work, either because of finances or just sometimes depending on who their supervisor is, they just don't want to stay home, but you're better off staying home. I noticed with myself when, I got sick a few weeks ago, and you try to just push through, but you're actually less efficient. And, you're thinking that, oh, well, it's not that bad. And sometimes it is. Like with my particular thing, it wasn't that big of a deal. It wasn't a cold. It wasn't a flu. It was just like a weird kind of tickle in my throat that wouldn't go away. And I just pushed through thinking it would get better. And it actually lasted a lot longer just because I didn't rest. So as a physician, I always joke with my patients, they remind me of what things I need to do as well. Sometimes when you have these little things, especially if it isn't too dramatic, it's your reminder that you need to rest and you need to take care of yourself and you need to take a dose of your own medicine. Some of the things that I talk about with my patients, it's my reminder that I need to do these things as well. So stay home, get that rest if you need that rest, get some sleep, drink your fluids. Do some things so that you don't create an environment where these viruses will take hold. Now, when you actually do get the flu, there are many drugs that the CDC recommends, and these are drugs that you may have heard of because your doctor may have given it to you if you actually have had the flu. What's interesting is there are a good amount of these antiviral drugs, but it's not the type of thing that you want to abuse. Obviously, you want to make sure that you're taking care of yourself so you don't have to take these drugs. Some of the drugs, like one in particular, it's called Rapivab, it's given intravenously. So that's obviously something, if someone's gotten to that state, it's obviously a really bad flu situation. And for some people like that, it's a life or death situation. So these are not, I don't want anyone to get too comfortable thinking, oh, well, if I do get the flu, I'll just take this drug and I'll be fine. No, these drugs also come with severe side effects, and they're aimed to be taken only when necessary. Another popular drug that's used is Romantadine, and then also Tamiflu. I think that's the one most people are familiar with. And they're shown to be effective against influenza viruses that are similar to that 1918 virus that I talked about. So they've actually designed these drugs so they can handle even the most virulent forms of the influenza virus. And what they've seen with the research is that these drugs can shorten the time of illness to 1 or 2 days. So going back to what I said before, these drugs are only shortening 1 to 2 days. So you don't want to be reliant on this drug and say, oh, well, I'm just not going to really take care of myself. There's always this drug. No, 1 or 2 days. So that means you're still going to be dealing with the difficulties of whatever comes along with the flu vaccine. And most importantly, these drugs are made to help people who are the most immunocompromised. They're not just created just for everyone to use at their leisure. So some do's and don'ts about what you should be doing to prevent or kind of keep yourself healthy. We talked a little bit about some more, and I want to talk about just a few more things to keep in mind. We mentioned what kind of diet that you should have, but something very easily that you can do if you don't want to take supplementation is just increasing the vitamin A and the vitamin C in your foods. Remember when you were little and your mother gave you that cod liver oil? So many people have so many bad memories about cod liver oil. But in actuality, cod liver oil is very powerful. Cod liver oil is very rich in vitamin A and vitamin D. And I mentioned earlier how there are some research studies that have shown vitamin D to be just as effective as taking the flu vaccine. Now, the reason why they were saying this in this study, besides the what they actually tested, is because vitamin D is critical for your immune system. And they found that vitamin D, if your vitamin D is very, very low, you tend to be more susceptible to getting the flu. One thing that I recommend to people that they can do very easily is have your doctor check your vitamin D levels, and then you can get dosing accordingly. I don't like many times when people just say, oh, I'm just taking vitamin D and they're not being supervised. It's really important to know how much vitamin D is perfect for you, not just what someone else is doing. How much vitamin D do you need? And that's what I like about cod liver oil. It's such a powerful food. It's an oil, and it's so great for your immune system. And there's a reason why our grandmothers and mothers recommended that when we were little. The great thing is nowadays they have so many different products that don't taste as bad as the strains that you may have had, the actual products that you may have had when you were little. But again, just a reminder that some of those old school things still have they still carry so much weight nowadays. Some other foods that are rich in vitamin A include garlic, which we talked about already, onions. Vitamin C rich foods include oranges and grapefruit, lemons. We talked about elderberries, pineapples, honey. We talked about honey along with the propolis and how amazing that is for your immune system. And then also rich in vitamin A, green leafy vegetables. And all these things, these are foods, and all these foods can help give our body the nutrients it needs to be able to fight off some of these invaders. One simple thing that you can do along with some of the other recommendations that we made is doing a steam inhalation. That's something, again, it's so simple, doesn't cost you much money. Doing a steam inhalation, just boiling some water. Either you put a towel over your head and lean your head over the pot of boiling water and just let the steam come in. You can also add essential oils to it. Essential oils are very helpful at allowing the congestion to dissipate a little bit. If you add in some peppermint oil, I like to do something really simple and just put in a few drops of peppermint oil or any oil that you like, and you can just drop that on the floor of the shower and then let the hot water run. That's a great way to do it, steam inhalation. Another thing that you can do, this is kind of old school naturopathic, is to create a hot foot bath. And this is part of what we call hydrotherapy, and that's using water therapy to enhance the immune system. So you put your feet in the hot foot bath first, and you keep your feet in the bath for 20 minutes. Then you run cold water over them and then dry your feet. You can do this like 1 hour before bed. This is kind of similar to a wet socks treatment, if any of you are familiar with that. And if you're not, you can do a Google search on wet socks treatment. That's something that you can do, cold, flu, that can be very helpful in just strengthening your immune system and kind of waking up your immune system. And sometimes people are wondering what the difference is between the cold and the flu. So I'm going to go back to that and talk about some symptoms that you may encounter, and then think to yourself, could this be the cold or this could be a flu? And the reason why I'm going over this is because sometimes, again, like I mentioned before, people just push through and they say, oh, I'm not that sick, and they keep going, not realizing that it could be something more serious. So I'm going to highlight some of these symptoms and let you know most likely what this could be. So if your symptom onset is very abrupt, most likely that's the flu, whereas the cold comes in more gradually. Fever, as I mentioned before, most likely that's the flu. Having a fever with the cold is very, very rare. If you're having aches and pain, this goes along with having the flu, as opposed to a cold where sometimes you feel a little achy, but it's not as apparent the way it is with the flu. Chills. If you're feeling chills, that's pretty common with the flu, whereas having a cold, chills are really uncommon. Fatigue and weakness, that kind of goes along with either or. With the flu, it's the usual, whereas a cold, sometimes you feel a little weak and fatigued. But again, that's the body, responding to this viral illness that's come in. So for both, you're going to feel some level of fatigue and weakness. Sneezing with the flu, sometimes, whereas a cold, that's very, very common. Stuffy nose, very common with the cold, as opposed to the flu, where you may notice the stuffy nose sometimes. Sore throat, again, very common with the cold, whereas with the flu, sometimes you may notice a sore throat, maybe difficulty speaking, some, level of discomfort. And with chest discomfort and a cough, definitely the flu, very, very common, as opposed to a cold, that's pretty mild to moderate discomfort in the chest and also with a cough. It's not going to be very, very severe. Headache, very common with the flu, more rare with the cold. So think to yourself, when you're having these symptoms, do I have the cold? Do I have flu? What's going on? I hope some of this breakdown was very helpful for you in knowing what you should do with cold or flu season. I always mention that this topic is kind of like the elephant in the room. Everyone's talking about it and people are trying to figure out what to do about it. And it's something that's going to be with us. It's not going to go away. So it's important to know how can you protect yourself and to know what your options are. Of course, nowadays it's not difficult for people to see that they can easily get a flu vaccine, but I like my patients to take some responsibility and know that there are other things that they can control. There are ways to strengthen your immune system. There are ways to prepare yourself for cold and flu season. So regardless of whatever decision you make, you're an informed consumer, so to speak. You know what works for your body. You start to watch your body and you can make a decision on, whether something will work or not, because now you're informed. We talked about what the flu was. So now you actually can know what it is and not be as fearful. It's a virus. It's something that is not going away anytime soon. So we might as well get comfortable with the idea of what it is, how it affects us. And I think that when you're a little bit more educated about what something is, it's very empowering. It helps you to be able to, we can't control many things in life, but when you have information is really powerful. Knowing what something is and how it affects your body lets you take some responsibility on how you're going to treat your body, how you're going to move into the world, how you're going to avoid certain triggers that may be harmful to the body. And also that you can, as I mentioned before, you can actually strengthen your immune system so you don't feel the effects of a cold or flu as severely. And these are very simple things that can be done. And now you understand why there are recommendations for the flu. You understand how it changes every year and how those changes can affect human beings. I hope this was helpful for you today. And thank you for listening. We are going to be back here at the same place, same time, the fourth Saturday of every month, WPKN 89.5 FM in Bridgeport. And I am Dr. Jennifer Pierre. Tune in with me next time as we talk about some more things with Seeking Wellness, Our Bodies Explained. Be sure to tune in or check out our website, wpkn.org, where you can listen to past podcasts that we have and also any archives. Take care and thanks for listening.